So let's talk about common excuses that I hear from dentists on why they run late. Number one would be the front office are booking the wrong timing. Well, if this is happening a lot, you need to report that, and you need to report that to management and see why this is happening. But dentists who are chronically running late, usually they use it as an excuse, because if it happens once or twice, we can deal with it, or as an owner, you can deal with it. But if it's happening a lot, why it hasn't been stopped? And if you have more than one clinician in the practice that are running on time, why it's only happening to one clinician? Another reason was always mentioned is the patient wanted to have, this extra filling done because they traveled from far away, or the patient just wanted me to finish the other crown as well. Don't let the patient dictate your appointment book. Do not let the patient dictate that you have to do unplanned treatment. So most times, I believe it's an excuse, and the dentist is trying to increase or maximize production in the appointment. Do not try to maximize the production at the expense of burning your staff and burning your other patients. So do not do unplanned treatment in your appointment time. So one of the most common reasons is doing unplanned treatment to increase production in an appointment time that something wasn't planned for. Adding a scale and clean into an appointment, a restorative appointment, adding extra restorative fillings that wasn't planned. So patients who chronically run late, usually they want to increase production on the sake of the whole business as an establishment. A third reason or excuse is the DA is not trained enough. And again, if you're in a practice where other clinicians are running on time, you have to question why it's only happening with that clinician. But again, you're the clinician. So even if you have a trainee DA and getting training, you need to allocate your time accordingly and manage your time accordingly.